I'm Dr. Daniel Kantor, Neurology in Real Time, and I'm joined here by Dr. Carrie Downey, who is a fellow in multiple sclerosis at the University of South Florida at USF. Thank you so much for joining us.
Of course.
Your research, the poster we're standing in front of, has to do with multiple sclerosis and has to do with fatigue and sleep.
Yes.
Can you tell us a little bit more about it?
So we have started seeing that a lot of people were complaining of fatigue that couldn't be treated. And so I was asking the question, should we be evaluating for potentially sleep disorders? As some of the research a couple of years ago have come out saying that there's about a 30% increased risk of sleeping disorders in the MS population compared to general population. So we implemented the Epworth scale to see if we could capture potentially sleepy patients that's not necessarily due to fatigue. And then we were seeing if we referred them, if their scales improved and if their fatigue improves.
And what did you find?
So it started in January. So we've referred about 16 patients. And because we're such a tertiary center, only one of them has a scheduled appointment at our facility.
Okay.
So we're waiting to see when they come back and follow up what their sleep specialist says.
Now, you're a fellow in multiple sclerosis. For a lot of people back home, they're wondering what that means. What is a fellow versus being a resident versus being an attending?
So I have completed my residency and I have a board certification. But I wanted to subspecialize in MS so that I could take care of MS patients because the population of MS patients really intrigues me, and I feel like there's a lot of information we still don't know about it, and can really help their lives by effectively treating their disease.
How early in your training did you realize you want to focus on multiple sclerosis?
I actually had a mid-residency crisis. I initially wanted to do neuromuscular, but then I decided that was pretty boring. And I talked to my mentor, and he kind of helped me weigh pros and cons, and I ended up in MS because of the patient population.
Well, we're glad to have you in MS. We need more dedicated physicians to be in the world of MS and to be helping all the people back home. I want to thank you for joining us, and I want to thank all of you for joining us with Real Time Neurology.